David Siebert. I'm an assistant professor in the Department of Family Medicine at the University of Washington School of Medicine. So the main point of our review, and the reason we really wanted to put this review out there, is to emphasize that cardiac arrest, when it does occur during an athletic sporting event like soccer game, football game, or a basketball game, with proper preparation beforehand and an AED there and available, it's largely a survivable event. I mean, mortality rates historically, when this happens, have been really poor. But as we've been kind of instituted programs to make AEDs more available and training programs to train people on how to respond, those survival rates have risen quite dramatically, actually. The survival rate in cardiac arrest, kind of in general, anywhere, is fairly poor. Some studies have cited less than 10% when it occurs in the community. These are historical studies, though, and AED programs, so publicly available AEDs, have been shown to increase that rate up to as high as 40 or even higher, 40% or even higher survival rate. These points include things like making sure an AED is there and the battery is not dead. I mean, it's as simple as things like that. Also making sure it's not locked behind a gate, or if it is, someone has access to it and is able to get it when it's needed. Because an AED is not useful if you can't get to it. Finally, first off, recognizing cardiac arrest, because a lot of people will collapse when they go into cardiac arrest, will collapse and have seizure-like activity or look like they're breathing, but it's actually not real breathing. It is actually signs of not having blood flow to the brain that's causing these things to happen. And that should not make people think, oh, that's not cardiac arrest. That's a seizure. Seizure-like activity is seen 50% of the time. And actually to have like an annual rehearsal and like a mock cardiac arrest drill, which is something we do here to make sure that everyone involved and everyone that may still have a responsibility or something to do during a cardiac arrest knows what to do, where the AED is, who to call, how to direct the ambulance there, and how to actually make things go as seamlessly as possible. If you see somebody go down and they're not breathing and they are in some serious trouble, it can cause a little bit of a panic for responders as well, and they don't know necessarily what to do. And you know, if you're not previously trained and previously have gone through rehearsal drills, it's very easy to freeze up or attribute a cardiac arrest to a seizure, even though that's not what it is, or similar things like that. I think one of the main points that I would drive home is that if you see somebody collapse on the field without getting contacted at all by like another player, for example, you assume that it's cardiac arrest until you are sure it's not. And if and when that is cardiac arrest and you're working to use the defibrillator, you can't harm somebody who doesn't have a pulse. If they don't have a pulse, they have minutes and they need help. You can't kill someone who's already dead is really kind of one of the major points that I would drive home to for people who are not specifically trained with this but are actually there and potentially have access to an AED or no CPR. If someone's not responding and you saw them go down and they're collapsed, you assume cardiac arrest, which means they are not alive and they need help. The simple AEDs that are accessible to the public will recommend a shock in the appropriate situation, and they're very good at telling you if a shock is not appropriate. Okay. So if they do have a pulse and things like that. So when you come up to an unresponsive patient, you confirm they're unresponsive, ask, are you there? If they're not responsive, you get your AED and open it up, and it starts automatically.
Call for help now.
You'd call for help or have somebody else call for help.
Clothing from chest.
You would expose the chest, shave away any excess body hair, and dry the area. It's totally safe to use the AED even if it's rainy or wet, but you want to dry it so the pads will stick.
Pull red handle to open bag.
You get the bag.
Peel each pad off blue plastic.
The bag with the pads,
and then apply pads to exposed chest.
Peel them off and place them where it shows. We're basically surrounding the heart.
Evaluating heart rhythm. Stand by. Preparing to shock. Everyone clear. Press flashing button. Shock delivered. Do not touch patient. Evaluating heart rhythm. Shock delivered. Do not touch patient. Evaluating heart rhythm.
And then it restarts the cycle.